We had some great questions submitted beyond what we could answer during the broadcast portion of the show, so let's just try to get those answered. An email question came in. Any comment on the use of ginger in some form to help acid reflux and digestive troubles?
I don't know necessarily about that. I know if you look online, you can Google it, you'll find out that ginger will actually help with motion sickness and things like that. But there are also some vinegar solutions that people use for reflux. But I think the biggest and most important thing you can take from acid reflux is if you have a lot of symptoms, you should probably seek help from your doctor because it's not something you want to mess with.
Right. And I think in the long run, over-the-counter omeprazole is really probably the most staid answer. Elevate the head of the bed, though, I would say that's number one.
Yep.
I've heard wintergreen for GI tract and spearmint, those kinds of things. Have you heard that?
Yeah, mint for whatever reason helps with nausea as well. Can maybe help with reflux, but again, acid reflux, you worry about esophageal cancer. It's not something you want to just willy-nilly treat.
Right. 65-year-old woman from Rapid City. I've not been able to sleep for more than 2 hours at a time. Where would be the closest to Rapid City for getting the sleep test?
I'm sure you could get with the pulmonologist group there or your primary care provider to send you somebody who's a sleep specialist and get evaluated to see whether you have sleep apnea or something else that's causing you to wake.
There's pulmonologists in Rapid.
Yep.
Go there, get it tested. An 84-year-old man from Worthington. I had a pneumonia shot in the last few years, and now the doctors are saying that my right lung is only functioning at 90%, and my left is functioning at 80%. I received 2 nebulizer treatments today. However, the treatment is expensive. Is there any alternative treatments, and has anyone seen a similar reaction?
I don't think that the pneumonia vaccine has ever caused any lung problems. I think it helps to prevent you from having significant lung problems and can decrease death, especially in our pediatric and elderly population.
Right.
But the lung function abnormalities are probably related to some other reason.
Right. And what are we recommending? Prevnar for anybody 65 and older, and then follow a year later with Pneumovax?
Yep. And if you're immunocompetent, or excuse me, immunocompromised, such as you have a bone marrow transplant, they recommend Prevnar sooner. If you've got the Pneumovax before the age of 65, they recommend another one after the age of 65. But there's a lot of, before or after Prevnar stuff that you have to look at. So.
Yeah. Prevnar is the main one right now.
Yeah.
I think the guy's 90% of his lungs are working. I mean, that's pretty good, really.
Actually, normal pulmonary function, if you and I were to do spirometry, as you know, anything above 80 is normal. So,
pretty close to normal.
Yep.
I don't know why the problem of nebulizers.
Well, the problem with nebulizers and inhalers, there aren't too many generics on the market. So talking with your pharmacy to find out what is covered, and depending on your age, is it Medicare supplement that pays or Medicare Part B? Right. Sometimes going down a different route will help you.
There's been some recent diagnosis of RSV, and I've seen it in the adult population last winter. What do you know about RSV? I mean, it's typically kids, but what's the story about it?
No, RSV, we get it. We just don't get it as severe as children get it. So every patient that comes into the hospital that we see on our pulmonary service from about October till March gets a viral respiratory panel. We see influenza, parainfluenza, RSV, human metapneumovirus, which is a new one out there that causes a lot of problems. So it's just a viral infection, and sometimes if your immune system's down, it can make you really sick.
And then pneumonia follows.
Yeah.
And that can kill you.
Some of those viruses actually alter the white blood cell function that sets you up for secondary bacterial pneumonia and can be very severe.
So do you recommend RSV vaccinations in adults, or I don't think we do.
I don't know that there's any literature out there on that.
Via email, I use a CPAP, and since I started using it, it seems that I have developed a tendency to have ear discomfort or ear infections. Any association between the two, and what do you know about that?
The eustachian tube, which is a canal that drains from inside the eardrum down to the back of the throat, can sometimes become inflamed because of sinus issues and those kind of things. So typically when you get an ear infection, obviously that area is obstructed and pus builds up in there and sets you up. So sometimes people just have an intolerance to CPAP because it'll fill up the ear with air and cause lots of pressure. Whether it's truly causing an infection is probably hard to say.
Okay. Any particular comments about influenza and influenza vaccinations that you would say?
It's herd immunization, meaning that if everybody were to get immunized, the chance of getting influenza would be much, much less, and the death rate of influenza would be much, much less. There's good evidence out there that getting your flu shot can be beneficial at either preventing it or lessening the risk of severity. So it's a little poke in the arm, you should get it. Obviously, there's some evidence out there that the nasal spray in kids isn't beneficial, so they're just going to have that little needle there and get over it.
But it's actually, I've heard that the majority of the infections that kill elderly come from little kids.
Yeah.
And that the Prevnar vaccinations in kids have saved thousands and thousands of lives of adults.
I mean, that's just it. All it takes is one person to not get immunized, get influenza, and then you spread it to somebody else, and it's a...
Particularly the elderly who are immunocompromised just by their age.
Yep.
Any particular take-home messages that you want to finish with? No more questions.
No. If you think you have sleep apnea, get tested. If you're smoking, stop.
Very good. Well, we thank you so much for joining us.
Thank you.
And thank you for joining us on our website, and appreciate all your questions and the opportunity to answer them. Until next time, from all of us at On Call with the Prairie Doc, stay healthy out there, people.